Bilirubin high?
In today's video, we discover what causes high bilirubin levels in blood, what are the symptoms of high bilirubin, and how to naturally lower elevated bilirubin levels.
Let's start with understanding what causes elevated bilirubin in your blood. Bilirubin is a yellow compound that forms when old red blood cells break down in your body. Under normal circumstances, your liver processes this bilirubin and removes it through bile. However, when this process is disrupted, bilirubin levels can rise significantly.
Studies show that approximately 5% of the adult population experiences elevated bilirubin levels at some point in their lives. But what exactly causes these elevations?
One of the primary causes is Gilbert's syndrome, a genetic condition affecting about 3 to 7% of the population. With Gilbert's syndrome, your liver doesn't process bilirubin efficiently, leading to mild elevations. Importantly, this condition is usually harmless and doesn't require treatment.
Liver diseases represent another significant cause of high bilirubin. Conditions like hepatitis, cirrhosis, and fatty liver disease can impair your liver's ability to process bilirubin effectively. Research indicates that about 30% of cases of elevated bilirubin are related to underlying liver conditions.
Blood disorders can also lead to increased bilirubin levels. When red blood cells break down too quickly, a condition known as hemolysis occurs. This overwhelms your liver's capacity to process the excess bilirubin. Approximately 15% of high bilirubin cases are linked to various blood disorders.
Certain medications can interfere with bilirubin processing. Common antibiotics, some anti-inflammatory drugs, and certain birth control pills have been associated with elevated bilirubin levels. Medical data suggests that medication-induced bilirubin elevation occurs in about 10% of cases. Recent research has revealed interesting connections between stress and bilirubin levels. During periods of intense physical or emotional stress, some people experience temporary increases in their bilirubin levels. This occurs in about 8% of documented cases.
Environmental toxins and certain workplace exposures can also contribute to elevated bilirubin. Industrial chemicals, pesticides, and other toxic substances can impact liver function. Research suggests that about 7% of occupational health screenings reveal elevated bilirubin levels potentially linked to environmental exposures.
Nutritional factors can also play a role. Prolonged fasting or severe caloric restriction can impact liver function and bilirubin processing. Studies show that about 5% of elevated bilirubin cases are linked to dietary factors.
If you're finding this information about bilirubin helpful, take a moment to like this video and subscribe to our channel. This helps us reach more people who might be looking for this important health information. Alcohol consumption significantly impacts bilirubin levels. Regular heavy drinking can impair liver function and lead to increased bilirubin. Medical data indicates that approximately 25% of individuals with chronic alcohol use show elevated bilirubin levels.
Age plays a role too. As we get older, our liver's efficiency in processing bilirubin may decrease. Studies indicate that people over 60 are about 12% more likely to experience elevated bilirubin levels compared to younger adults.
Interestingly, some research suggests that moderate elevation of bilirubin might actually have protective effects against certain cardiovascular diseases. This is due to bilirubin's antioxidant properties. However, this doesn't mean high levels should be ignored.
Recent medical surveys show that approximately 40% of people with elevated bilirubin levels were unaware of their condition until it was discovered during routine blood work. This highlights the importance of regular health screenings.
Understanding these causes is crucial because different underlying conditions require different approaches to treatment. While some causes like Gilbert's syndrome may not need intervention, others require immediate medical attention. Now, let's explore the common symptoms of high bilirubin levels. It's crucial to recognize these signs early, as they can indicate underlying health issues that require attention.
The most noticeable symptom of elevated bilirubin is jaundice, a yellowish discoloration of the skin and whites of the eyes. Studies show that jaundice becomes visible when bilirubin levels exceed 2.5 to 3 milligrams per deciliter, affecting approximately 85% of people with high bilirubin.
Interestingly, jaundice often appears first in the eyes. Medical observations indicate that about 90% of patients notice the yellowing of their eye whites before any skin changes occur. This makes regular self-examination of your eyes particularly important.
Dark urine is another common symptom, occurring in roughly 75% of cases. Your urine may appear brown or cola-colored, which happens when your body tries to eliminate excess bilirubin through urination. Fatigue and weakness are reported by about 70% of people with high bilirubin levels. However, it's important to note that these symptoms are nonspecific and could be related to various conditions.
Digestive issues are common, with approximately 60% of patients reporting symptoms like nausea, reduced appetite, and abdominal discomfort. These symptoms often develop gradually over time.
Itching, or pruritus, affects about 45% of individuals with elevated bilirubin. This occurs because bilirubin deposits in the skin can irritate nerve endings. The itching typically worsens at night.
Research shows that about 40% of patients experience mild to moderate headaches. These headaches often develop when bilirubin levels rise quickly, though they may become chronic in some cases.
Weight loss, even without trying, is reported by approximately 30% of individuals with persistently high bilirubin. This is often related to decreased appetite and changes in metabolism.
Some people experience mood changes and difficulty concentrating. Studies indicate that about 25% of patients report these cognitive symptoms, which may be related to the effects of high bilirubin on brain function.
In cases of severe elevation, about 20% of patients report dizziness and confusion. These symptoms require immediate medical attention as they could indicate serious complications.
Sleep disturbances affect approximately 35% of individuals with high bilirubin. This can include difficulty falling asleep, frequent waking, or changes in sleep patterns.
It's important to note that symptom severity often correlates with bilirubin levels. Medical data shows that mild elevations, under 3 mg per deciliter, may produce no noticeable symptoms in about 50% of cases. Monitoring these symptoms is crucial because their progression can indicate whether your condition is improving or worsening. About 55% of patients report that their symptoms develop gradually over several weeks.
Remember, these symptoms can vary significantly from person to person. While some individuals might experience multiple symptoms, others might only notice 1 or 2 signs, even with similar bilirubin levels. Let's explore natural methods to help reduce elevated bilirubin levels. While it's essential to work with healthcare providers, these natural approaches can support your body's bilirubin processing.
Hydration plays a crucial role. Research shows that increasing water intake to 2 to 3 liters daily helps about 65% of people with high bilirubin improve their levels. Water assists your body in flushing out toxins, including excess bilirubin.
Sunlight exposure can help break down bilirubin in your body. Studies indicate that 20 to 30 minutes of morning sunlight exposure can reduce bilirubin levels by up to 15% in some individuals. This is particularly effective in mild cases.
Certain foods have shown promising results in supporting liver function and bilirubin processing. Dark leafy greens like spinach and kale, rich in chlorophyll, have helped approximately 40% of patients improve their bilirubin levels when consumed regularly.
Garlic and onions contain compounds that boost liver function. Research suggests that incorporating these foods daily has helped about 35% of people with elevated bilirubin see improvements within a few weeks.
Regular exercise is another natural solution. Moderate physical activity for 30 minutes, 5 times a week, has shown to improve liver function in about 50% of cases. This includes activities like brisk walking, swimming, or cycling.
Herbal teas, particularly dandelion root and milk thistle tea, have demonstrated positive effects. Clinical observations show that about 45% of regular herbal tea drinkers experience improved liver function markers, including bilirubin levels.
Probiotics and fermented foods support digestive health and liver function. Studies indicate that regular consumption of probiotic-rich foods helps approximately 30% of people maintain healthier bilirubin levels.
Avoiding certain triggers is equally important. About 70% of people with Gilbert's syndrome notice improvements when they maintain regular eating patterns and avoid prolonged fasting.
Stress management techniques like meditation and yoga have shown surprising benefits. Research indicates that regular stress reduction practices help about 25% of individuals maintain more stable bilirubin levels.
Turmeric has powerful anti-inflammatory properties. When combined with black pepper for better absorption, studies show it helps improve liver function in approximately 40% of cases.
Adequate sleep is crucial. Getting 7 to 8 hours of quality sleep helps about 55% of people maintain better liver function and bilirubin processing. Maintaining a regular sleep schedule is particularly beneficial.
Avoiding alcohol and processed foods allows your liver to function more efficiently. Studies show that 80% of people who eliminate alcohol see improvements in their liver function tests, including bilirubin levels.
Fresh fruit juices, especially carrot and apple juice, have shown positive effects. About 35% of people who regularly consume these juices report improved liver function markers.
Time management is important too. Spreading your meals throughout the day and avoiding long gaps between eating has helped approximately 60% of people maintain more stable bilirubin levels.
Consider adding bitter foods to your diet, such as arugula and endive. These foods naturally stimulate bile production, helping about 30% of people process bilirubin more effectively. While these natural methods can be effective, always monitor your bilirubin levels through regular medical checkups.
Found this video helpful? Support us by hitting the like button and subscribing to our channel. Your engagement helps others find this important information about managing bilirubin levels.
Share this video with anyone you know who might be concerned about their bilirubin levels. Thanks for watching.